Doctors are well aware of the health risks associated with depression, but for some women, those risks may be greater than we thought. In a study released today, researchers say they've discovered a link between depression and stroke. And that's not all. The National's Joanna Remiliotos joins us now with more on this story. Joanna?
Amanda, experts say this is one of the largest studies that links depression and strokes, an association older women especially should not ignore.
Any attachment or...
It wasn't just one thing, but a series of dark moments that led to a diagnosis. 55-year-old Lynn Mock has battled depression for years.
Every small problem becomes a huge, insurmountable challenge.
Meditation is just one way she treats herself. It's a way to reclaim her optimism and her health, something depressed women especially can't take for granted. According to a new study that tracked more than 80,000 women in their 50s and older for 6 years, depression is associated with a 29% higher incidence of stroke. The study also found those on certain antidepressants had a 39% higher risk of suffering a stroke.
It should be a warning to the physicians and to the patients.
The study's author says the findings come even after adjusting for other risk factors, like smoking or being overweight.
We think that our study suggests depression can have its independent role in the development of stroke.
Other studies have linked depression to physical illness, including cardiovascular disease. And there has been other research, too, that suggests antidepressant use is associated with increased risk of cardiac death.
Some skills for staying well.
Mental health experts say women should not stop taking medication to treat depression, but should find other long-term strategies to cope.
There may be the need for an acute treatment that maybe helps to deal with the depression and to really reduce its intensity. And then once that's the case, then it's possible for women to start taking on board certain mindfulness, health-based practices to start looking after themselves to prevent depression from coming back.
Mock is doing just that. She took medication for a few months. Her focus now, staying healthy on her own.
I felt I needed, I guess you call them strategies for managing on my own.
The study's authors say more research is needed, but say they also hope more women battling depression become aware of the physical illnesses that could come with it. Amanda?
All right. Thanks so much, Joanna.